We start today in Puerto Rico, where the Blood Bank of Mutual Services is begging citizens to make donations to supply the high demand of blood for patients on the island of Puerto Rico. Our Francis Felix reports.
The Bank of Mutual Services of Puerto Rico is requesting people to make donations due to the low inventory caused by the pandemic situation. The Vice President of the Blood Bank of Mutual Services urged people to call and make appointments to donate. With the closeness of Holy Week, the donations tend to go down.
Due to the restrictions and the different lockdowns that were implemented according to the pandemic and the response from the government, it made it more difficult for people to attend to the different blood centers and provide their blood donations. So that created a crash on all the inventories that we had in hand, and it made it really difficult for us to collect the blood to supply the hospitals. Well, right now we're trying to boost our blood drives, which is a primary source for collecting blood throughout the island. We have 6 centers, fixed sites in different parts of the island, but we also try to do some outreach to different companies, pharmaceutical companies, schools, universities to perform the blood drives and make it more accessible to the people to participate. So with the recent lift on the restrictions for COVID, we've had more demand on being able to access those sites, different companies and universities, schools, and we're starting to ramp up on our inventory to be able to meet demand. We need on a daily basis around 200 units of blood collected to be able to supply the need of the hospitals. We're the primary supplier for about 30 to 40 hospitals on the island. So on a daily basis, we need to send out blood to all those hospitals. So in order to recuperate that inventory, we need to collect on an equal basis. So in order for us to be able to provide that blood and at the same time increase our inventories in order to be able to have a good on-hand inventory for any catastrophe, we need to collect about 200 units a day. So it's a pretty big effort. To collect 200 units of blood, you need to process probably about 250, 300 people because of the deferment factors. You have people that do not qualify for the donation. You have some tests that come out positive and you have to throw those units out. You have the no-show factor of people that say that they're going to come in to donate, but then they don't show up. So for us to be able to get those 200 units, we need to make the effort to get 250 to 300 people in order to get down to that number.
The blood bank needs 200 blood donors to supply their daily demand. They have 6 stations around the island for people to go and visit and make their donations. They need the cooperation of every citizen to get to help the patients. If you want to help, call the number below. From Guaynabo, Puerto Rico, Francis Felix.
All right, thanks so much, Francis. In the meantime, several chief medical officers from all over the Caribbean met for their first in-person Caribbean Health Agency meeting. The main topic of discussion was COVID-19 throughout the Caribbean. Our Deandra Hamilton brings us highlights today from that meeting.
The Caribbean Public Health Agency, or CARPHA, has held its first face-to-face meeting to discuss COVID-19 since the start of the pandemic in 2020. The forum, which ran from April 6th through 7th at the Trinidad Hilton in Trinidad and Tobago, was attended by 23 chief medical officers from member states, along with representatives from the regional and international development partners of CARPHA. In speaking at the forum, Executive Director Dr. Joy St. John recognized that people are experiencing COVID fatigue, which can make it difficult for them to pay attention to any discussion about COVID-19, even if it is one that will protect them from the illness. She explained with the relaxation of public health measures, people may feel that the pandemic is over, that the need for vaccination is also over. However, Dr. St. John encouraged member states to exercise vigilance. Some CMOs present at the meeting also commented on the session.
I'm happy to participate in the CARPHA's CMO's meeting. It will be beneficial to Trinidad and Tobago in that it allows the CMOs, the forum, to discuss openly and frankly amongst each other, amongst our peers.
Chief Medical Officer for Antigua and Barbuda, Dr. Rhonda Seeley Thomas, had a highlight.
What was a highlight for me yesterday, after the meeting yesterday, we were able to visit CARPHA and get a glimpse of more than a glimpse actually, a tour of the laboratory where they do genomic sequences for SARS-CoV-2 for Antigua and Barbuda.
Chairperson of the conference and CMO of Barbados, Dr. Kenneth George, noted that home isolation will continue to be critical and expressed gratitude for the meeting.
We believe that home isolation will continue to be critical in our responses.
DeAndre Hamilton reporting.
All right, thanks so much, DeAndre. Meantime, the Dominica government is exploring the removal of the customs service charges to cushion the impact of fuel prices on its citizens. Prime Minister Roosevelt Scarrett says his administration will soon announce measures aimed at easing the financial burden on Dominicans because of high fuel prices due to the ongoing conflict in Ukraine. That has resulted in quite the increased price for oil on the global market. Dominica, along with other CARICOM countries, including oil-rich Guyana and Trinidad and Tobago, have had to deal with the increased price of the commodity and are taking measures to cushion its effect on citizens. Prime Minister Scarrett said the government is exploring the possibility of the customs service charge on petroleum products imported into the country.
Some years ago, we had removed the excise tax and the customs service charge on LPG and kerosene. So there have been no taxes on kerosene and LPG in Dominica for the last, I believe, 8 or 9 years. Every cent that we can save the consumers is every cent remaining in their pocket, and especially in these times. And we're also looking at, in respect to additional importation in the country, the possibility of removing the freight and insurance as part of the consideration for tax for being subjected to customs duties and so on. But we do need analysis. We'll engage the private sector, because the key for this, when the government takes those decisions, that the benefit is passed on to the consumers. And so this is always our concern, that we don't usually see the benefits passing on to the consumers, because ultimately when a decision is taken to remove taxes on goods coming into the country, it's ready for the consumers to benefit. And so it's something we're looking at.
In the meantime, staffing issues are forcing JetBlue Airways to cut flights for the coming summer. JetBlue says it's canceling 8 to 10% of flights starting next month. Now, that's following a weekend of widespread cancellations it blamed on severe weather and staffing. A shortage of pilots and crew is now impacting other airlines too, hit by a surge in spring break travel, but less staff. Alaska Airlines said last week it's reducing about 2% of flights starting in June due to pilot capacity. In Delta Airlines, pilots are protesting the airline's schedule that they say leaves them overworked. And lastly, a baby formula shortage in many parts of the U.S. is now forcing retailers to ration their supplies. Walgreens is limiting shoppers to 3 infant and toddler formula products per transaction. A recent review of supplies at 11,000 stores indicates that nearly 30% of popular baby formula brands may be sold out. Cities like San Antonio and Minneapolis are reporting out-of-stock rates for certain formulas, even higher than that, well above 50%. Part of the problem stems from an Abbott nutrition recall in mid-February for select lots of Similac, along with other formulas made in Sturgis, Michigan. Now, manufacturers are ramping up production to make up the difference, but admit it may take weeks for them to catch up. And still to come here on One Caribbean News, as we continue through the pandemic, which U.S. city is now reinstating its face mask mandate? That and more. It's all ahead here on One Caribbean News. And still to come here on One Caribbean News, a study out shows how your personality can either protect or age your brain. We'll explain in 2 minutes. Welcome back to One Caribbean News. Well, it's time now for a look at the stories making headlines around the world. The city of Philadelphia is reinstating its indoor mask mandate. The policy change comes after the number of COVID cases in the city rose by 50% over the last 10 days. This makes Philadelphia the first, but likely not the last, the big U.S. city to reimpose mask mandates. This will go into effect starting Monday, April 18th. That's the same date the federal mask mandate for public transportation is set to expire, unless the Biden administration extends it. And worry less now and your brain will stay healthy longer. A new study shows people who worry more lack self-discipline and are introverted and are more likely to develop cognitive decline earlier in life. It also applies to a higher likelihood of developing Alzheimer's disease. The study examined the personality traits of nearly 2,000 people. It found being socially engaged with others could buy you an extra year of living without dementia. If you keep anxiety at bay and stay organized and goal-oriented, that can get you 2 years of healthy cognitive function. Now, this study was published on Monday in the Journal of Personality and Social Psychology. And lastly, a young boy was bit by a shark in South Florida. It all happened in shallow water in Palm Beach County. He said he saw the shark before it bit his foot and estimates it was about 4 feet long. The boy was taken to the hospital. We know sharks are not uncommon in shallow water, but unprovoked attacks are rare.